name's Dr. Scott Brandt, and I live here in the Vail Valley of beautiful Colorado. Vail's about a 2-hour drive from downtown Denver. We're straight up into the Rocky Mountains, just due west of Denver. thriveMD is a regenerative medicine clinic, so our focus is on making people better for the long run, keeping away the diseases of aging, and really focusing on allowing patients to perform their best as they get older. Sure, there's several different pieces of regenerative medicine. There's what I consider the interventional piece, and that's the stem cell side. That's taking living cells from a patient and returning them to areas of damage in that patient to maximize function. There's two primary areas in the body where we can harvest cells that are very, very useful for regenerative medicine. The two most common places are from adipose fat, or the fatty tissue in our body. That has by and far away, the most volume of adult or mesenchymal stem cells that can be used to maximize or return patients to function. So when you compare that area of the body, which has maybe somewhere in the neighborhood of 1,000 to 2,000 times more cells per volume than you would get from the other most common area, which is bone marrow. And bone marrow is the center of some of the big bones in the body. And that's where your blood cells are made and many of your other cells are made. You can get a vast quantity of cells from bone marrow. It's just that there are not that many of the cells that you can use to actually regenerate tissue in that source. The beautiful thing about using fat is that you can have this enormous amount of cell volume that is very, very powerful for expanding good tissue, for healing tendon, for healing joint spaces, for bringing lumbar discs back to life. Yeah. I mean, regenerative medicine, the act of doing these cases is multifactorial in that you have to be able to have several different skill sets in order to be able to do this right. I come with 20 years of interventional pain experience. I break it up into 3 pieces. There's really the harvest. Do you have the skill set to be able to go forward and go in and get the cells that you need from the patient's body? Do you have the ability to harvest bone marrow from the bone, the ability to harvest fat from the fat tissue, to be able to do that painlessly, comfortably, and in a way that the patient isn't hurt during that procedure? That's the first piece. Once you've got that initial harvest or the bulk of what we're going to use for cells, I look at that as raw material. That you then have to take that raw material and process it in some way that you can then inject that material into its target organ. It usually means consolidating those cells. When we take cells from bone marrow and fat, we're taking a large volume of bulk tissue. We then need to purify it and then take it down to a very small injectable volume. It needs to be filtered, it needs to be cleaned. Everything needs to be done in a sterile fashion. And in the end, especially when we're talking about injecting an area as small as, say, a lumbar disc, it's only going to hold a very, very small volume. And getting the most concentrated amount of the best cells and the best growth factors consolidated to a very small injectable amount, and then being able to deliver that specifically right to the target is what makes up a good injectionist. And those things just don't happen overnight. And it comes from, I've done tens of thousands of injections in just about every part of the spine, another tens of thousands of injections throughout the joints of the body.